Top medical and dental professionals convening for an annual conference. Students exploring their career opportunities. And a fashion icon to be honored.
The Bahamas Tonight Northern Edition starts now.
This is the Bahamas Tonight, the Northern Edition. Good evening, all. I'm Megan Shepard. Thank you so much for tuning in. Topping the news, medical professionals meeting here on Grand Bahama in a two-day conference. Last night, the conclave opened with an address from the Minister of Health, who foreshadowed some improvements that will soon take effect on Grand Bahama. Italia Hall reports.
Healthcare professionals meeting in the annual Medical and Dental Association conference. The theme, Universal Health, United to Fulfill the Vision. President of the organization, Dr. Vincent Burton, says the theme is timely, but it must become a reality for everyone to be healthy.
We want everybody to be healthy. It is our passion that we can live this vision out and that this will become a shared vision. It requires teamwork, of course, and a multifaceted, multidisciplinary approach.
The Minister of Health, Dr. the Honorable Dwayne Sands, bringing brief remarks, commending the association for their efforts. He says his ministry has a number of improvements on the drawing board, which include the expansion of the outpatient specialty program on Grand Bahama and the introduction of an oncology clinic. He says a new CAT scan machine is also on Grand Bahama and will be installed by the end of the month.
My ministry is also publicly recommitting to the renovation of the vacant area adjacent to the hospital's current administration office to establish a private ward service at the Rand. This is in addition to the redevelopment of the decanted kitchen cafeteria space to construct a new 8-bedded public ward inclusive of ICU bed expansion and an isolation room.
The minister says he is aware that he has been under fire recently due to the issues doctors, nurses, and other healthcare staff has with the Ministry of Health. But he says he wants to ensure those healthcare professionals that he, the ministry, and the government is committed to working along with them.
We are only concerned about forging the appropriate alliances and coming up with the appropriate compromises and consensus. And so while we may disagree, we intend to never allow it to remain disagreeable.
Dr. Robin Roberts speaking about the importance of a national healthcare insurance system in the country, adding that he knows that there are some who believe that the NHI initiative has stopped.
To date, we have some 40,000 Bahamians who are enrolled in the primary care program. We have over 80 primary care providers, providing 4 private labs across New Providence, Grand Bahama, Exuma, and Abaco. We also did a survey, and we looked at some almost some 3,000 of our individuals who are a part of our primary care program. We called them on the phone. We sent out surveys, and we asked them, how do you rate our primary care services? 95% of them said they were satisfied with the quality of service they received from the NHI primary providers.
The conference will close out on Saturday with a banquet at the Pelican Bay Resort. Reporting for ZNS Network News, I'm Italia Hall.
Founder and president of the Medical Pavilion out of New Providence addressing the conference today. His area of focus, the cost and availability of healthcare. Cardiologist Dr. Conville Brown addressing the conference on making catastrophic care more accessible and affordable. He says that this is one of the biggest issues for a developing country, and this is why he believes the government is working to have national health insurance.
In developing countries like ours, we have resource shortages, so to say, and so the government really cannot afford to pay for the health care for the entire nation. The private sector by itself cannot do so, and the individuals ourselves cannot afford to pay for all of our health care, whether we develop heart disease, cancer, kidney failure. I mean, the average Bahamian family does not make $100,000 a year, and that's what you could spend just for dialysis. Okay, so what we have looked at, going back several years now, more than a quarter of a century, we've looked at having a partnership between the private sector and the government sector, and of course the individuals, to see if we can spread the pain, so to say.
Dr. Brown notes that for the past 28 years, he has been working on a model called partnered care to increase access for the general population. He says he believes that the government should look into private-public partnerships in helping the general population.
I think it's a good step-off point for National Health Insurance to not just look at our form of a public-private partnership, which is what it is, but to look at any public-private partnership that helps to spread the burden, help to reduce costs, because in so doing, that's how we better or best increase access for all of those who are less fortunate amongst us, because not everybody has medical insurance that will allow for it, and even those that do have medical insurance cannot afford sometimes the copay, because the copay for your care might be more than your entire salary for the whole year. So I think it's really important, and as Dr. Roberts pointed out last night giving the keynote address, we need to be our brother's keeper.
He also expanded on some of his international work.
Been doing this now in the area of heart disease initially, because I'm a cardiologist, and then we've gone into cancer care, dialysis, and now we've also gone international, and we're providing cancer services for 9 countries down south, the Organization of Eastern Caribbean States, where we have a cancer center in Antigua, and we help to deliver radiation therapy to almost 1 million people, 1 million people population, that is, in Antigua and the surrounding countries.
Health concerns forcing the early closure of the 8 Mile Rock High School today. Thick plumes of smoke blanketed the area coming from the nearby dump site. We spoke to Principal Chester Cooper about the situation.
This morning when the staff came in, there's a bushfire in the back of the school. So some of the smoke would have blown across to blanket the campus. It wasn't as bad initially, but after the fire department was called and they were outing the fire, I think more smoke kind of blanketed the campus. It became a bit unbearable. We had the kids in the gymnasium for a period of time. I spoke with Mr. Butler. The ministry's put certain protocols in place for dealing with these kind of situations, and they take the safety of staff and students very seriously. And once I spoke to Mr. Butler, we made a determination to dismiss school.
Cooper says school was dismissed before noon. Several teachers and students fell ill and were taken to hospital.
There are a few persons who suffered from smoke inhalation, and a few of them were transported to the Grand Memorial Hospital as well as the 8 Mile Rock Clinic. So a few students, about 4 of them, and a few teachers. I went to the hospital about half an hour ago, and they're doing pretty well. The staff at the RAND was doing an excellent job in checking on them and giving them oxygen. So they should be dismissed by this afternoon, hopefully. And as you can see here now, it's kind of clear. So we're hoping that tomorrow we'll be back up and running.
Students of the 8 Mile Rock High School are being asked to report to school tomorrow at 8:45 a.m. You're watching the Bahamas Tonight, the Northern Edition. Stay with us. There's more news right after this break.